If you've been struggling with years and years of knee pain and are finally considering undergoing knee replacement surgery, this video attempts to shed some light on some common perceptions about what to expect following knee replacement surgery. Pain following knee replacement surgery is sometimes difficult to fully predict because each individual patient has a different pain threshold, experience, and coping mechanism that impacts their pain experience at each different stage of their recovery. The breakthrough opioid-type medications are taken generally for a few days to a couple of weeks and almost universally are discontinued by about 1 month and almost rarely by 3 months following surgery. Your comfort is also very important in the early phase of the recovery, and therefore there are multiple different intervention points that are accessible by the surgeon as well as by the anesthesiologist that help to significantly limit your pain experience following surgery. Among the different types of analgesic or pain relieving interventions that can be utilized following knee replacement include anesthetic blocks, where the anesthesiologist will meet with you shortly before the procedure and perform one of a couple of different types of injections around your knee. These injections serve to numb the nerves that provide the sensation to the knee and therefore significantly limit the pain experience in the early phases of the recovery. Also helpful in the early phases of your recovery include an anesthetic cocktail injection that is performed by the surgeon in the tissues surrounding the knee replacement and the resected and replaced bones, and therefore can also significantly limit the pain experience following the surgery. Another significant innovation in knee replacement surgery that has facilitated early discharge has been the advent and increasingly common utilization of spinal anesthesia. Spinal anesthesia involves an injection by the anesthesiologist either in the operating suite or in the preoperative holding area that numbs the nerves that control the legs and therefore limits the pain and experience of pain following the surgery. This procedure also limits the density of the anesthesia required to complete the procedure and therefore allows the patient to be sedated during the procedure with a very early recovery, waking up, and return to ambulation and walking. The timeline for knee replacement recovery includes early mobilization and walking that is typically performed the day of surgery, and stairs are encouraged within the first day or the ensuing several days following the procedure. Generally, you will be provided an assistive device, typically a walker, that will help with your balance, control, and ability to perform stairs. The weeks following the procedure, your function, pain, and ability to negotiate stairs and perform independent daily activities gradually improves, and typically patients can discontinue the walker or the assistive device at 3 to 4 weeks. Things like driving are resumed approximately 4 weeks following surgery, and you can start reciprocally or one leg after the other performing stairs, as well as with the surgical leg first, which is initially more challenging for patients. By 6 to 8 weeks following surgery, the knee motion is continuing to normalize, the swelling is almost resolved, and your ability to perform more fluid and normal daily movements are increasingly easier. Return to work following knee replacement is somewhat more of an individualized discussion and depends on several factors, including your age, your limitations following surgery, as well as the demands that you have at the workplace. In general terms, most patients are able to resume sedentary work at around 4 weeks and more heavy labor type demands at around 3 months or greater following knee replacement. Usually, by around 8 weeks or 2 months following surgery, patients can get back to the golf course for chipping and putting with a full round performed around 3 months following replacement. Similarly, things like pickleball can be performed around 3 months following surgery with gradual improvements in strength and function of the knee that continues to 6 to 9 months or more following the replacement. Rehab following knee replacement, again, is somewhat dependent on individual factors. However, the majority of the time, patients that are more motivated to get up, walk, and resume activities as soon as possible generally experience better functional gains in the long run with their knee replacement. The very early rehab generally involves an aide or an assistant that comes into the home that helps with motion, strengthening of the knee, as well as early mobility and walking to facilitate your early recovery at home. The home health aide coming into the home will assist you with early mobility and utilization of a cane or a walker, ensure that your incision looks okay, and ensure that your pain medication is being taken as prescribed. As your function and strength continues to improve, typically we recommend patients get to the outpatient physical therapy clinic setting at about 2 weeks following replacement so that they can work on a more individualized one-on-one basis with a trained outpatient physical therapist. The duration of the outpatient physical therapy is typically about 6 to 8 weeks, but can be variable depending on your progress and your specific needs. A common concern about the longevity of a knee replacement is how long will the implant last. With modern implant designs and new, highly refined ways of engineering the plastic liner called polyethylene, the rates of significant wear of the implant necessitating revision or failure of the implant are exceedingly low. In fact, if you achieve an early, favorable result, the chance that you will require revision in your lifetime is very, very low, especially after 25 or 30 years. Also, that may be borne out in long-term studies, the utilization of robotic technology, which facilitates more precise implant sizing, positioning, and ligament balancing, may improve the longevity of the implant in the long term. Thank you for your interest in knee replacement recovery, and please see our website for more information.